My dear students, Assalamu alaikum. Welcome to your online class. In this lecture, we are going to discuss about a very important topic, that is anemia. Anemia is very common clinical condition in our country, and it also affects 1/3 of the global population. It mainly affects the female during pregnancy and also the children and elderly people. When a person is suffering from anemia, it decreases the person's ability to work. So it is very important to detect anemia and to correct the condition. For detection of anemia, we need to know the red cell indices or absolute values. These are calculations that gives us information on the physical characteristics of RBC. The red cell indices are mean corpuscular volume MCV, mean corpuscular hemoglobin MCH, and mean corpuscular hemoglobin concentration, that is MCHC. MCV or mean corpuscular hemoglobin means the average volume of each RBC. Mean corpuscular volume MCV. It is the average volume of each RBC. The normal level is 76 to 96 femtoliter, and that RBC is called a normocyte. If the MCV is more than 96 femtoliter, then that RBC is called a macrocyte. As the cell size is increased, so it is macro. And when MCV is less than 76 femtoliter, that is called a microcyte, that is small size. So here you can see this is a normal MCV, that is a normocyte RBC, and when the cell size has decreased, then this is called a microcyte, and if the cell size has increased, then it is called a macrocyte. MCH or mean corpuscular hemoglobin. It is the average amount of hemoglobin present in a single RBC. Not the whole blood, but in a single RBC, the amount of hemoglobin that is present. The normal level is 27 to 32 picogram. And if the hemoglobin in a single RBC is decreased in amount, that is less than 25 picogram, then that condition is called hypochromic. Chrome means color, and hemoglobin is responsible for the red color of the RBC. So when there is decreased levels of hemoglobin, then the color will decrease, so it is hypochromic. MCHC, this means mean corpuscular hemoglobin concentration. It represents the relationship between red cell volume and its percentage saturation with hemoglobin. The normal level is 31 to 35 gram per deciliter. Now these levels, these red cell indices are calculated by using three parameters. One is the total red cell count, the hemoglobin level, and PCV. And by using certain formulas, we can find out the red cell indices. Now let us come to anemia. Anemia can be defined as the qualitative or quantitative deficiency of RBC or hemoglobin below the normal range in respect of age and sex of the individual. So, in an anemic patient, the RBC level may be decreased or the hemoglobin level may be decreased, and it can be a qualitative deficiency or a quantitative deficiency. The word anemia is a Greek word that means lack of blood. So when a person is suffering from anemia, there will be decreased level of RBC or hemoglobin, and we have to know it in respect of the age and sex of the individual. Now the morphological classification of anemia, which is based on the red cell indices. First, we have Normocytic Normochromic Anemia. This means the cell size is normal, normocytic, normochromic. The hemoglobin level is normal, but we are saying anemia. So why we are saying anemia? Because there is quantitative deficiency. There is no problem with the quality of RBC or hemoglobin, but there is quantitative deficiency of RBC or hemoglobin. If you remember that anemia can occur if there is a qualitative deficiency or a quantitative deficiency. So in normocytic normochromic anemia, this occurs when there is acute blood loss. So when there is acute blood loss, there is no problem with the quality of RBC or hemoglobin, but there is problem with the quantity. The amount of RBC or hemoglobin has decreased due to the blood loss. So this type of anemia is called normocytic normochromic anemia. Then we have microcytic hypochromic anemia. From the name you can see microcytic, that means the cell size is decreased, MCV is decreased. Hypochromic, this means hemoglobin level is also decreased. So this is a qualitative deficiency. And examples of this is iron deficiency anemia and thalassemia. And the last one is macrocytic anemia. Macro means the MCV is more than 96 femtoliter. That means the cell size is increased. So this is also a qualitative defect, and the example of macrocytic anemia is megaloblastic anemia. So these are the three types of anemia where anemia is classified morphologically based on the red cell indices. So if we do a summary of the red cell indices in these type of anemias, in normocytic normochromic anemia we will find MCV normal, MCH normal and MCHC also normal. So there is no problem in the quality, but it is a quantitative deficiency. In microcytic hypochromic anemia, MCV will be decreased, MCH decreased and MCHC is also decreased. So it is a qualitative deficiency. And in macrocytic normochromic anemia, MCV is increased, MCH is increased, but MCHC is normal. So macrocytic, that means both our MCV will be more than 96 femtoliter, cell size is increased. So what is the most common anemia in our country? As we all know, it is the iron deficiency anemia, and the main causes of this is malnutrition, hookworm infestation, peptic ulcer, and in female excessive menstruation or frequent pregnancy. So when a patient comes to you with anemia, what do you suggest the patient? To eat some iron containing foods, and some of the iron containing foods are egg yolk and meat and kochu shak, and you can see here we have broccoli and we have pulses. So all these are iron containing foods, and along with this you also have to advise the patient to take vitamin C, because we know that vitamin C is needed for hemoglobinization, and these are the vitamin C containing foods, the citrus foods that contain vitamin C. And the clinical key to detect anemia, if you examine the patient, you can easily detect 3 signs in a patient and see whether the patient is suffering from anemia or not. First, we will see the lower palpebral conjunctiva, and here we will see that there is pallor. Normally there is a pinkish color, but if the person is suffering from anemia, then it will be pale or whitish in color. Then if you examine the tongue of the person, this is the tongue of a normal person and this is the tongue of an anemic person. You can see that the tongue is also paler. And the nails of the person is another thing that you can examine, and the nail beds will also be pale and it will be brittle nails. Brittle nail means it easily breaks. So these are the 3 signs that you can detect to see whether a person is suffering from anemia or not, and then we can do the laboratory test to see the red cell indices, and ultimately we can diagnose anemia. to correct the anemia. It is very important, as I have already told you, that if a person is suffering from anemia, he will always feel lethargic, and it will decrease the productivity of that person. So this is all about anemia. I hope the video is useful for you. So until next time, thank you and Allah Hafiz.